not have melanin on their skin, they lack the protein, which is melanin, to protect you from ultraviolet lights. And that increases the likelihood of skin cancer. So what I'm trying to explain to you is that we need melanin to protect us from the ultraviolet rays that produce skin cancer, and those people who are genetically recessive, people who are fair color, people who do not have pigment, people who are not melanated. Unmelanated people, they don't have the protein to protect them from the most abundant source of energy on our planet, which is sunlight, and they are at risk for skin cancer. So when we're looking at skin lesions, I'm talking about any type of marking or mole on your skin that develops an abnormality. We have to seek further professional help to ensure that it's not malignant. Oops. And malignant means that it's cancerous.
Okay.
And it spreads, which can kill you. You understand?
Okay.
So there's something called the ABCDEs of skin cancer. And you have to write this down and make sure you become familiar with it, okay?
Okay.
When we're looking at moles, when we're looking at anything that grows, do you have any moles on your skin, sir, Mr. Tayo?
No.
You don't have any moles?
I don't have any moles.
Oh, okay, that's nice. That's nice. I have a couple of moles, right? So when you have any type of lesion, any type of mole or something on your skin, you have to assess it to see if it's normal or abnormal. And we use this tool of ABCDEs. A stands for asymmetry. Whoops, there's two M's in asymmetry. Hold on. Asymmetry. So asymmetry means that the mole, if it's not even when you break it down in half, meaning if the mole is supposed to look like this. When you break it in half, the left and the right, they both are relatively the same size, correct?
Okay.
But if the mole looks like this, it's no longer symmetrical. Now it's asymmetrical, meaning it's not the same on both sides. That's a red flag. You have to report that. You have to seek more investigation from your doctor, another opinion to assess that, okay?
Okay.
You're also looking at the border. The border, as you see right here, and as you see right here, the one on this side that I'm pointing the arrow to now, it's smooth, but the border on the right side is irregular. So if you have an irregular border, that's also a red flag. You need to have a second opinion. You need to get that checked out.
Okay.
Then you have to look at the color. The color should be the same throughout. So regardless as to whether it's red, if it's all red, that's okay. If the color is black, that's fine, as long as it's all black. If the color is, and usually red ones are actually, you should have those investigated. But I'm trying to prove the point that the color has to be consistent. If you at some point have a transition of color from red to brown, from brown to black, that's also considered a red flag. You must get that checked out. Okay. The D stands for the diameter. It's supposed to be less than 1 cm. If it's greater than 1 cm, then you want to check it out, because the bigger the mole is, the higher likelihood it's going to become cancerous. Okay. So if the diameter is larger than 1 cm, that also has to be checked out. That's a red flag. And E stands for either elevation, meaning it's raised, or evolving. Has it changed in its shape, in its morphology? Has it gone from a small one to a bigger one? Is it now raised? Was it flat before like this? Was it flat relatively, and now is it raised like that? So, or elevation or evolving. If any of those things have happened to the mole, that's another red flag. You got to get that checked out. Does that make sense, sir?
Yes, sir.
When it comes to skin cancer, there's 3 basic types. There is, the first one is known as basal cell carcinoma. Remember that oma is tumor or growth. So basal cell carcinoma is the least malignant. It's got the best prognosis. So basal cell carcinoma has the best prognosis, meaning that it rarely becomes malignant. It doesn't become cancerous. It does not metastasize. So basal cell carcinoma can be treated fairly easily. Sometimes you don't even have to remove it. I've seen a lot of my patients at the facilities, at the convalescent homes at times when they're older, and you notice that they have a history of basal cell carcinoma, but they're not going to have it removed because it rarely becomes malignant. It rarely becomes detrimentally cancerous. So we could just leave it there. Does that make sense, sir?
Yes, sir.
The second type is known as squamous cell carcinoma. This one's a little bit different. This one can become aggressive. The only thing that you need to know about this one is that it should be detected early. Because if it's detected early, then we can remove it and it will not become malignant. Does that make sense, sir?
Yes, sir.
So with squamous cell carcinoma, it just depends on whether we catch it early or we don't. If we don't catch it early, it can become aggressive. So these patients that have squamous cell carcinoma, if you get it early, then you have good prognosis, but it's time sensitive. Okay.
Yes, sir.
And the last one is known as malignant melanoma. So what I mean by that is the same cells that produce the protein melanin, those become cancers. Those are very aggressive because they receive blood supply so the cells can produce their melanin. So when they develop cancer, they're connected to the bloodstream, and that can cause the cancer to spread to other organs, and that becomes a problem. Okay, so malignant melanoma is the most aggressive, and it also metastasizes.
Okay.
It spreads. So we have to be very careful. That's why we have to educate our patients. Those who are at risk for skin cancer are people who have blue eyes, who have blonde or red hair, those who are not pigmented, those who turn red
Oh, okay.
with sun exposure, those who sunbathe, meaning those who spend a lot of time out in the sun without the SPF sunblock. Those patients are at risk for skin breakdown. Does that make sense? I mean, for developing skin cancer. Does that make sense, sir?
Yes, sir.
Any questions on this one?
No.
Let me know when I can clear it. Let me know when I can clear it out.
Yeah, you can clear it now.
I'm good?
Yeah.
Oh, so I can clear it, sir?
Yes, sir.